Hello and welcome to India Top Doctor. Today we will talking about healthcare challenges in semi-rural India. We have a very special guest, Dr. Satish Kumar, a very well asset for Wellmark Hospital, a 70-plus bedded multi-specialty tertiary care hospital, centrally located at Bokaro Steel City, Jharkhand, and run by a team of doctors of reputed in their fields. So let's welcome him. Sir, so welcome to India Top Doctor.
Thank you.
As you know, today we will be talking about the challenges healthcare face in rural areas or semi-rural areas. So what is your opinion? What do you think are the challenges of rural healthcare, sir?
See, during last COVID pandemic, we have seen how we have fared as far as healthcare is concerned, particularly if there is a need of a critical care scenario. It's a really very big challenge throughout India, although a lot of things have happened in certain parts of our country, like in South or even in West. The situation is now better, but I would say that overall, in rural or semi-urban area, you can say, the situation is still pathetic. And the reasons are many, affordability of healthcare, communication, and health education, and there are many. This has to do a lot of things about the overall situation of our country. Still, it is quite lacking in rural areas. Although communication has improved quite a bit, but as far as healthcare condition is concerned, particularly for intermediary or tertiary care, the things are not acceptable still. So these are the challenges. Affordability, of course, is one of the biggest challenge, because you know that the purchasing power of our rural populace is not that good still, despite there are various programs. Government of India as well as different state governments are doing a lot for upliftment of rural populace, but still things are not up to level which you can say it is satisfactory. So that's it. Yeah.
All right, sir. And what do you think, or in your experience, what are the major health issues which are seen in rural areas? Can you tell us about that?
In earlier days, we used to see more of infectious diseases or diseases related to different kind of infections like malaria, tuberculosis, diarrheal diseases. Situation like this more often in the rural areas, and in urban populace, the lifestyle related diseases like diabetes, hypertension, coronary artery disease used to be more, but now things are changing. Even in rural areas, the lifestyle has changed a lot. Due to, you can say, the mechanization of agriculture, and as we are not as poor, or poverty is not as much to that extent that it was about 2 or 3 decades ago. Things have changed. Even in rural areas now, we are very much seeing a lot of cases of diabetes, obesity, and lifestyle related diseases, hypertension. It is as rife as in used to be in urban areas. So the disease pattern, with some changes, remain the same. Even in urban areas, you can see that in the slum dwellers, because they are also part of the urban populace. So the disease pattern is same. Even diarrheal diseases are quite rife in them. The diseases due to infections are quite common. So now the difference between the rural and urban is now a bit, vanishing, and we are encountering almost similar pattern in rural and urban areas, due to certainly the improvement in some quality of life, as well as the purchase. The control or infections, because we have the government has gone a very long way in uh, vaccination programs. So those infections have reduced a bit, but still the other diseases have taken over, like diabetes, hypertension, and coronary artery disease. So they are becoming as common as in rural areas as well as in urban populace.
Okay. So as you said that the difference between rural and urban areas health issues are diminishing a little bit. But what is your opinion on the lack of feasibility of healthcare in rural areas?
Feasibility are multi-pronged. You can say feasibility in it is not the lack of feasibility. It is, we have to think it differently. Say, it is not feasible for a poor person who has no money to get him treated or get tested. So from his point of view or her point of view, this is a difficult situation. That is one, and that is important. From other point of view, like healthcare providers or the government, it is not that it is not feasible. It is now becoming feasible to make very good roads in rural areas. Now we are having very good roads. So if that is feasible, why not a good hospital is possible in these areas? It is only just, a way of thinking, or political will, and or you can say entrepreneur will, because not we should not depend only on government. We have to have our own. Those who have some vision and some money should invest in healthcare in rural areas, because you see, when a person becomes sick, suppose somebody has got a bad pneumonia, even in taluka level, it cannot be treated well, unfortunately, at this point. He has to go to a large city or maybe a metropolitan city, and he'll be nowhere. He can't afford even 2 days of therapy there in bigger hospitals, corporate hospitals. I won't say that corporate hospitals are not doing good, because there is a lot of money involved in it, and they have to somehow bring it back, and they have to pay a lot of salary to a lot of people. They have to expend heavily on electricity and maintenance of different gadgets that are placed there. So it is, but the thing is that we have to do something in a different way, so that it becomes affordable to those person who cannot think of going to these bigger hospitals. And there are various ways to do it. Like uh, making a big hospital is really difficult, and managing it, maintaining it is a difficult thing. What we have, what I think is that there are a lot of good doctors who can have a smaller hospitals of their expertise. Say, somebody is diabetologist, he is running a diabetic clinic. Somebody is cardiologist, he is running a good cardiac center. Somebody is having there is a nephrologist. It is really difficult to make one big hospital for all of them. But if they, contribute on their own, and communicate properly within, and make a hub or a spoke model, so that whenever somebody requires a service of a different specialty, he can get it done there at some affordable price, because then affordability becomes much less a problem than in a quite a big hospital. So that is one way. And then we have to think about more pragmatic view of the expenditure that are taking place while doing this treatment, like expenditure on antibiotics. Antibiotics are one of the most expensive things that need to be involved in treating diseases, particularly in our country, because infections are a lot rife. If you maintain a proper aseptic or hygienic condition in your hospital, probably you'll be requiring a lesser and lesser quantity of antibiotics, and that way you can reduce the cost of therapy. Similarly, the days of hospitalization, you can reduce it, definitely. A procedure like angiography can be done on a daycare basis. The person now, it is feasible through radial artery. You're not requiring a femoral to puncture and keeping the patient in bed for a day or two. You can do it through that route. And if the things are okay, you can release him on the same day. So the cost of therapy that way will be reduced. Similarly, in different procedures, the number of days that the person has to remain in hospital can be reduced to quite a significant manner, and that way the things become more feasible and affordable. Similarly, the of course, everywhere you cannot have an air-conditioned kind of but if you, of course, but in healthcare, I won't say that air conditioning is a luxury. It is not. Like in operation theaters, you do require an AC situation. In different dialysis unit, you do require it. But your machines have to be kept properly. That environment. So you do require it. But for like a lobby, probably you can manage with fans or air coolers. So that way, these are the things, small things, but they do affect on our expenditure. And if you transfer it to our patients in a subdued way, probably the cost of therapy becomes lesser. So these are the methods that I would say that can help us. And definitely what I told that multiple small hospitals run with the different specialties. If they collaborate in a proper way, probably we can do much better than what a bigger hospital can do. So, yeah.
So as you said that AC is very much important in hospitals, at least in operation theaters or for dialysis purposes. So is that has anything to do with the health of the person or the patient?
Not the health of the person, but because there are various equipments that need to be maintained at a particular temperature. No? Like you have dialysis machines. They cannot work in a very humid and hot conditions. Of course, patients' comfort is one of the things, but these equipments are very delicate. They are very sensitive, heat sensitive and all. Sometimes short circuitry is there due to humidity, because in our situation, there is not only it's hot, but it is quite humid. And so you have to maintain those environments. So to proper functioning of these equipments, delicate electronic equipments. So I meant by that. And of course, in OTs, you cannot have open windows for air, cooling. You have to have a closed operation theater where AC becomes an important, thing to place. Yeah.
All right, sir. That was really a very informative information you gave us. And so what changes do you think government could possibly make in order to better this situation?
Yeah, as I've just mentioned, these are one of these measures can help us. But again, the basic fundamental thing becomes affordability. How to improve the affordability of healthcare. Now, here I mean healthcare not for primary healthcare or just promotive healthcare, but for tertiary or care, like a person requiring hospitalization of a critical illness, suppose myocardial infarction, that is heart attack. It cannot be managed in a primary health center setup. You need to have a proper cath lab to go for various specialized investigations. Now, how it can be improved? One is uh, all government of India is already doing a lot of. I mean, most of the states have, accepted the PMJ plan, that is Ayushman Bharat. So it is a very big step. As far as healthcare is concerned, we can have group insurances for, suppose, Manrega workers. If we can make them through, and banks are ready for it. If we have a small, with small, insurance, health insurance contribution from them, if you can make a big group insurance policy for them, that will be very helpful. Similarly, we are trying to do in a different way. We are saying, say, you deposit us whenever, even if you are healthy, you deposit us for such and so much amount to us. Make your own health card. We'll check you initially, everything. That may be free. And it kind of family health card. And whenever you have a illness, serious illness requiring hospitalization, this will be kind of insurance from our side. You'll have to pay much less or maybe nothing. If so, hospital generated health insurance or hospital, but small hospitals cannot, do a lot of this much. But if you make a group of hospitals, smaller nursing homes, or all coming together, making similar kind of, healthcare policies. So this way, with a minimum premium from them. So these measures can help us in rural areas also. Of course, they have to be very transparent, and there are a lot of things that we need to see. So how much we can afford, do with it. But of course, as I said, that PMJ or the Pradhan Mantri Jan Arogya Yojana, more popularly called the Ayushman Bharat Yojana, is a very good program, and probably this is going to change the overall health scenario in rural areas as well. So let us hope. We are still, we have not been enrolled with it, our center, but we are trying, and we are trying to help in that way, because I won't say that their package is bad. Only thing is that we have to reduce our, cost of therapy. And just as I said you, that by reducing the number of days that for hospitalization, by number of antibiotics that we use, the other various important measures that a hospital needs to expend on. So that way we can do a lot. And we are trying, I'm working at Bokaro. It's a small town. And we have just started our heart center here with a cath lab. And we are claiming, and we are still trying, that this will become one of the models of the how at minimum price we can afford, we can give the best of therapies. Because the government of India has capped the price of stents. So that is one. That's a very good way and a very welcome step. So that has brought the treatment therapy of cost of therapy to a significant low level. Uh, but still, the procedure cost is remains high, in particularly in bigger hospitals. It is still above 1 lakh or so. We are trying to make it almost half of it. So that is how it is possible. Uh, and there are various ways. We have to just do some brainstorming and try to apply it. Yeah.
All right, sir. And let's talk about your hospital. How is Wellmark Hospital contributing in the betterment of the same?
Yeah. Uh, Wellmark Hospital is when I started it during the second COVID pandemic, that was very bad. We are running with for oxygen and cylinders. People were not getting beds, so that was a very bad scenario. Even I was affected during that period, and that was the time when we fortunately just had our oxygen this pipeline settled just before that, and we had to start it in a hurry, because even our relatives were falling sick every day, and we were not having beds anywhere. So that was a very bad situation to start with. But still, fortunately, by God's grace, we could save a lot of people with very bad lungs. Uh, and we have till now become the center of excellence in this area of this is a steel city, and there is a surrounding coal belt. We have various uh, mines of coal and steel surrounding this. So uh, uh, the overall the population is of kind of workers who are working in these mines, and also they do or have these all sorts of diseases that you can imagine of. So we are trying to help them, and in a big way, in whatever way it's possible for us at a much affordable price. So our cath lab is running round the clock. I have requested several of our students. I have been DNB faculty, so and many of my students are now very good. They have done DM cardiology and in different subjects. So many of them were ready to help me in this venture. And they have come, and and this is being the one of the best center in this area for cardiology, for nephrology, dialysis services, for surgery. Uh, we are going to start neurosurgery as well, neurology. Various retired neurologists have come together to and we are trying to be as economical as possible. We are not looking for profits. We are just trying to because most of the colleagues that they have their life, almost half of our lives we have spent. We have whatever we have earned. Our uh, I mean, uh, our children are well settled, so money is not a big issue for us. Now the thing is that we have come together to do something, and this hospital is run by doctors only, uh, and prove something and achieve something in whatever life that have left with. So that is what. Um, and so this is slowly making a lot of change in this area. Now the people are not running to Kolkata or nearby Ranchi for when they are getting heart attacks. We are able to give them treatment right here, and we well within time, with very good with results by God's grace. So this is how things are coming up. and we are very, upbeat about it. We are going to make a lot of change. Yeah.
And surely is a very great initiative by you, sir.
Yeah.
So during your journey with Wellmark and while dealing with the patients, what were some of the biggest challenges you faced?
Uh, yeah. We were not businessmen initially. I mean, say, we were doctors. So when we decided that, okay, we have to start one hospital, a good one, uh, kind of boutique kind of hospital. It should not be very, it should not look very costly hospital or very big, but it should be reasonably good with all necessary facilities. For example, if a person has been admitted with a situation like sepsis and he requires a dialysis therapy, he should not go away. It should be available somewhere here only. Similarly, if he requires a ventilatory support, it should be done here only. So, with those things in mind, we made a good team of 6, 7 doctors, and then the biggest challenge was how to get the location and a proper location. Fortunately, one of our friends had a very good structure with to known to his so that way we got it at a quite reasonable rent, and then we slowly started our own contributions, and started buying equipments, initially very necessary equipments. Some of we got as donations from our previous patients, and that was very nice of them. Different groups like Rotary Club, and they contributed to quite an extent, particularly when we are needing these oxygen concentrators, uh, things like that. So they were quite helpful in that. Later on, the banks are coming in a big way. Now they are ready to give you whatever you need. Of course, you have to be very judicious to prepay them in time, and you have to keep your books very clean. So, in fact, that was one of our biggest struggle: how to do, this managerial kind of thing or accountancy kind of thing. Gradually, we had our friend, our chartered account. We involved one chartered accountant to look about all these things, because we are not very good at all these things, and we had no time. We were more involved in the patient care and doctory, what you say, than anything else. But gradually things are improved, and now we are in much comfortable condition. So, just an entrepreneur skill for a doctor is very important. That what I would suggest to my colleagues, my junior colleagues, my students, uh, because in coming days, it is not just that you should know only about the medical thing, but you should also know about how to manage your finances. It is very important. And these are the practical things that one will require when he becomes 50 years or 60 years of his age. Then you need to manage them properly. And properly means you have to utilize for not only for yourself, but for others. You can make a difference. You can you can give a lot of jobs to many people. Our hospital has, now 150 plus employees, and we are very happy when we see that we are at least able to pay them and in time, and there many families are dependent on this. So one day when it was just in our minds, and today when we have this much of employees and they are paid, we are really happy. That is gives us the biggest satisfaction when our patients are getting treated and going home with smiles, when our staff are being paid their remunerations in time, and they are happy. So that is the biggest satisfaction for all of the doctors that who are involved in it. Yeah.
Thank you so much, sir, for imparting your wisdom to our audience. It was really great talking to you. At last, I just want to ask one last question, sir. Any message you would like to give to our audience?
I have learned a lot. I mean, biggest lesson in my life when I was fighting with COVID. Sorry.
It's okay, sir.
One day I was almost dead. So on that day, I decided that, see, what is life? It is not just for you. And if the God has given you opportunity to do something for others, you must do it. You must do it. And because we have got the second life, the whatever life that is ahead of us should be for others. So, and we can change a lot of, I mean, you see, when I see my employee's son with his celebrating birthdays with balloons, that gives me a lot of satisfaction. And these are the things that I mean, say that we should not live for ourselves. That what I have learned in second, of my life that God has given me. So that's it. We should think of living for others.
Absolutely, sir. Thank you so much, sir.
Thank you. Thank you very much.
Thank you so much. And I hope the best.
I hope you will edit those parts. I'm sorry. I'm sorry.
That's okay, sir. We listen.
Okay, fine.
I hope the best for your future, sir, and for Wellmark.
Thank you. Thank you.
Thank you so much.